Oi!
There's the common cold and stuff.
Common ones like hay fever and like allergies.
Flu.
I mean, personally, I get a lot of colds. People get like chicken pox, people get cancer.
I think a lot of people suffer with a lot of mental health illness. Like, I think depression is a common thing.
Like, I think a lot of people have mental health problems. After COVID especially, a lot of people are having difficulties with that.
I don't normally get that ill. I used to get tonsillitis often.
Never had anything very serious happen with me, so that's a good thing.
I had I think it was like a throat virus or whatever. I caught a nasty bug, so I had to call my GP to get like a prescription and all that.
Yeah, I've been in hospital, I had to have an operation on my teeth.
I had a knee operation because my knee was my legs were born a bit underdeveloped, so they had to get some bone to fuse it, to connect it.
I've been in hospital a few times, but that's only because I've burnt my arm, twisted my wrist.
I think I did catch COVID, but I just stayed in bed.
When I was 16 or 17, diagnosed with anxiety and depression.
I have a problem with gender dysphoria.
I was in hospital for an open heart surgery when I was younger. The doctors told me and my mum I wouldn't survive my 13th, and I'm 23 and I'm still here.
Yeah, I have to go regularly to get my hearing checked.
I can break bones quite easily, so I've broken quite a lot, so I've had to go to doctors about that.
I suffered with a detached retina in my eye, and I had an operation to remove it.
I have blocked every year.
I've got a counsellor for my mental health through a charity at the moment, which is helping a lot, I think, yeah.
Not since I was really young, because the doctors scare me. I've got anxiety about a lot of things, so.
I've been suffering with depression. I only became aware of it when it got really bad, and it got to the point of me basically self-harming myself. At that point, I saw how bad it got and sought help for myself.
I've been referred to a clinic, a gender clinic, a few times now, and I still don't know what's going on. They're only currently giving first appointments to people that were referred in July of 2018. There are some support groups around. I did try one of them, but kinda didn't go anywhere.
I also like to donate blood, so I've access to that. There's many different places here you can donate, and you can also donate plasma, which is quite helpful.
All my life I've had really good support.
Oxford Hospital, and it was very nice.
They were good, they were very helpful and informative, and they helped me understand what was happening. I think they do quite a good job. They do have a very big impact in the world. They save lives on a daily basis.
Maybe get better pay for the NHS, because I feel like they do a lot of work around in the hospital, especially in COVID times.
Yeah, even though I'm a person with SCN, but with autism, it's still good. They help me.
Recently I've been having to go to the doctors about a surgery I'm having. I talked to the surgeon about some concerns I had, and she answered them very professionally. It made me feel calm, since I have a habit of overthinking.
The only time I go to the doctor is pretty much when I'm almost dying, because I don't like doctors that much. I have quite bad trust issues.
I feel like healthcare is good here. The problem is the waiting.
Got really frustrated because I was waiting around the hospital for 4 hours to be seen by the consultant, and it got really hot and stuffy and I nearly passed out.
Relieved to finally hear that I am on the list. But yeah, it's been a hassle trying to get it sorted.
With the anxiety and depression wasn't great because I went to the Andy clinic and they just kind of said, oh, you're fine, get up with it and deal with it. And then it was my GP who then diagnosed me.
Saying if someone has a broken leg, they would notice that, whereas because it's mental, autism, it's mental, they don't see it as much, so they don't notice to give you as much help as you would need to, as you'd have as a physical disability or problem.
It took a while for me to get diagnosed, and I think the wait list could have been dealt with better. And then when I was diagnosed, it was almost like they're just trying to get through all the people that they have waiting. So they diagnose you and they don't really help you afterwards. So they gave me meds and stuff, but they didn't give you coping mechanisms and tell you how to kind of give you any support with the diagnosis that they gave you.
I was on a waiting list for CAMHS for 4 years, only now just getting seen, but I got help from YMCA.
In terms of CAMHS, I was on a 3-year waiting list, and in that time my mental health quickly decreased, so it just got worse and worse until I was completely unable to cope with myself. They gave me somebody who I was allowed to have for 6 weeks. It took me 4 weeks to trust them, and then I only had 2 sessions left with them before I was moved on to another person.
Some people don't really like the healthcare system, but it's better than what it is in Romania, in my opinion.
I would never something do at no appointment.
If there's a room that you could just calm yourself down in, like a room with fidgets or something.
I have a 5 hospital appointment. I don't like missing college or my health appointment. I wish they could be at the same clinic on the same day.
When I'm not well enough or feeling sick, I can just go to the doctors. The doctors in my area are nice, they're helpful.
Yeah, I know where to go now that I've had the opportunity to be involved in other groups that help young people.
At my school there's a place called Medical where they're very nice people.
Mental health support, maybe the Star Centre within school, like a council, yeah.
We do have a mental health support team here. We can go and speak to them and book appointments with them if we feel like that's necessary.
Not just hospital, Courage Certain Mind or mental health people, these people need help and we'll talk about it, yeah.
I feel like I would, yeah.
I think so. I think healthcare is going to get better, hopefully, and then it'll be more accessible to people who need it.
I think I'm going to get the right healthcare and support whenever I need it. I'm always happy to ask, always happy to speak to someone.
I think I will, hopefully. Yeah, I trust doctors, yeah.
I say probably for my physical health I will, but maybe not for my mental health because I find it hard communicating to people if I'm having trouble with stuff.
Yeah, there's just a lot of places that I can go to, or young people can go to, and especially if these places make it more aware, then a lot more people will be going to them.
Yeah, they like these stalls and things. There's always things going on. I know there's always going to be someone there available if I need help.
Find the information they need on the NHS website and things like that. It makes it really easy and straightforward for people of all demographics to find where they need to go.
I hope so, yeah. I'm not really sure, to be honest. I don't know what there is, really.
I think right now, as it's going, I have the opportunity to get as much help as I can, so I'm using that to my advantage. because I'm not sure whether that help will still be stable in 7-8 years' time.